So today we will look into some of the important case studies related to diarrhea. Some of one or two cases we have already seen, but now we will look into this case. Okay, now we have to apply all our knowledge and approach to understand this case. Okay, a 12-year-old child with the recurrent episodes of loose stool for the last 1 year. Okay, see, 12 साल का बच्चा है. He has got recurrent episodes of loose stools, diarrhea, for last 1 year. Since last 1 year, yes, it's a chronic. Okay, because since last 1 year problem is there. Each time he is treated with some of the antibiotics. Okay, each time he is treated with some of the antibiotics, and he is getting better for a few days. Yeah, he has been treated with the antibiotics, and after giving the antibiotics, he is better for a few days. And there is loss of weight noticed. Parents also notice a lot of loss of weight. Now the physical examination of the child was done, and physical examination shows stool is non-sticky. Stool is non-sticky. Abdominal distension is present, and there is also mild tenderness all over the abdomen. Diffuse tenderness is there all over the abdomen. And there is no hepatosplenomegaly. There is no ascites. Okay, there is no ascites. Now look at the HB. HB is 8. Okay, WB is 18,000. Polymorph 78, lymphocytes 18, monocytes 2, eosinophils 2, platelets 5.2 lakhs. Okay, 5.2 lakhs. Serum protein is 5.7. Serum protein 5.7. Albumin is 2.2 and globulin is 3.5. Okay, this is the total presentation of the patient. Now you have to understand, apply all your knowledge so far that you have learned to understand this case. So go step by step. Do you think it is a small intestinal diarrhea or large intestinal diarrhea? Yes? Anybody? Do you think it is a small intestinal diarrhea?
Large intestine.
Stool is non-sticky. Abdominal distension is present. Mild tenderness all over the body is present. All over the abdomen is present. And the loss of weight is there. And each time he is treated with the antibiotics and getting better.
Small intestine.
Okay, you say it is large intestine. Go to the next question. Do you think it is inflammatory or non-inflammatory?
Inflammatory sir, WBC बढ़ा हुआ है.
Very good. WBC बढ़ा हुआ है. It may be inflammatory, and polymorphous is also increased. That is inflammatory. And one more important thing is patient is getting somewhat better after the use of the antibiotics. So maybe some of the infective inflammatory causes. Okay. So you say that is a large intestinal diarrhea, and you say that it is inflammatory diarrhea. And do you think it is an acute cause or a chronic cause?
Chronic cause.
Okay, cause according to you is chronic again. Okay. And patient
1
is...
year sir, 1 year.
1 year, and there is also recurrent episodes are there. Okay. Now, if you look into the investigation, serum protein is somewhat on the lower side. Albumin is also somewhat lower. Serum protein should be somewhere around 7 or 8, but it is 5.7. Albumin is around more than 3. Now, albumin is also less. Globulin is also less than the normal. Okay, so protein is somewhat less here. And abdominal distension and mild tenderness is also present. According to you, it is a large intestinal diarrhea. Okay. According to you, it is an inflammatory diarrhea. Okay. According to you, it is a chronic diarrhea. Okay. Now, if you look into this case, do you identify which particular malabsorption is more here? Is it carbohydrate related or fat related or protein related?
Abdominal distension is a carbohydrate related.
Yes, abdominal distension is there. Therefore, you think that it is carbohydrate related. Very good. Then, but there is also loss of weight. But maybe because of chronicity, but there is loss of weight is also there. And serum protein is also reduced. Okay. Albumin is also less.
Electrolyte imbalance भी है, मतलब loss of plasma protein.
Okay. Electrolyte disturbance might have been resulted in abdominal distension. ठीक है, जो वो भी है. Okay. So anyway, this much of insight we have. Now we get into the case proper. Let us have a discussion now. Recurrent attacks of the diarrhea since last 1 year. One thing is very clear, this is a chronic problem. You also told. Another is child nutrition is affected, definitely, because weight is lost. As there is a loss of weight, so malabsorption is there. And there is also mild tenderness over the abdomen and also we get benefited by the antibiotic course. So definitely it is inflammatory. So far what we have told is right. So this is inflammatory, maybe infective or maybe non-infective. Okay, inflammatory तो पक्का है, because pain tenderness जहाँ पे है, इसका मतलब inflammation है. वो infective हो सकता है, non-infective हो सकता है, वो अलग बात है. Now, previous history of antibiotics and also response suggests that infection which is recurrent and may be bacterial. Antibiotics के लिए patient बहुत अच्छा respond कर रहा है, तो इसका मतलब है definitely it have been a bacterial infection, no doubt. Now CBC, as you have pointed out, CBC is increased. Okay, so definitely it is a bacterial origin, no doubt. Now, coming to the abdominal distension, as I told previously, abdominal distension है वहाँ पे, and that suggests that there is some electrolyte imbalance existing, especially potassium. Okay, so electrolyte imbalance भी चल रहा है. So now low plasma protein suggests that plasma proteins are lost due to subsequent infective diarrhea. Plasma protein जो कम हुआ है, ठीक है, so इसकी वजह से so we can say that due to subsequent infective diarrhea, plasma protein के amount भी कम हुआ है. So now actually this is a little tough case, but often we get such cases in the practice. So actually this is a case of inflammatory bowel disease. Inflammatory bowel disease जो chronicity है, loss of weight चल रहा है, infection भी चल रहा है. So there is a combination of a large intestine and small intestine both. Although there is no blood, although there is no mucus etc. coming, but mucus भी मतलब stool भी बताया उसने non sticky है, ठीक है. यहाँ पे actually absorption के साथ भी problem है और large intestine के साथ भी problem है. So such cases we used to get, but when you get such cases, so usually we have to think about inflammatory bowel disease. The hallmark of the inflammatory bowel disease is okay, the overall condition of the patient is very poor. General condition of the patient is very poor, and you have mixed symptoms, large intestinal and small intestinal both. Okay, so if you look into the stool content here, see on the physical examination, stool is non-sticky and stool के amount उसने नहीं बताया कि वो large amount of stool है. That means इसका मतलब है comparatively a small amount of the stool is passing, ठीक है. And again bad smell ऐसा कुछ चीज़ नहीं है, but overall जो है loss of weight is noticed. That means absorption तो नहीं हो रहा है, nutrients का absorption तो नहीं हो रहा है, ठीक है. large intestinal problem है तो weight के साथ problem कम आता है, क्योंकि वहाँ पे आते आते maximum चीज़ सब absorb हो जाता है, ठीक है. बट यहाँ पे लॉस ऑफ वेट है तो इसका मतलब है न्यूट्रिशन का एब्जॉर्प्शन ठीक से नहीं हुआ है, इसलिए इट इज़ ऑल्सो ए स्मॉल इंटेस्टिनल डायरिया. बट सम ऑफ द सिम्टम्स आर ऑल्सो सजेस्ट ऑफ लार्ज इंटेस्टिनल डायरिया, स्मॉल अमाउंट ऑफ द स्टूल एंड ऑल दोस थिंग. सो दिस इज अ मिक्स टाइप है. और सबसे इंपॉर्टेंट क्या है कि इट इज़ हैपनिंग रिकरेंटली, है ना, रिकरेंटली आ रहा है. कोई भी डायरिया जब इतना 1 साल से उसको रिकरेंटली आ रहा है, वो भी 12 साल का बच्चा है, जब ये रिकरेंटली व्हेन इट इज़ हैपनिंग सिंस लास्ट 1 year, there is every possibility that both small intestine and large intestines will get affected. Okay, so this is actually, we get such cases and this is actually a malabsorption problem, and this is usually considered as a inflammatory bowel disease. Now if you look into the same in terms of Ayurveda, okay, so Ayurveda, this is a typical case of what you say कफजा अतिसार. जो कफज अतिसार का जो कंडीशंस है स्लोली डेवलपिंग है, ठीक है, इट्स स्लोली डेवलपिंग, और मे बी सन्निपात कॉज स्लोली डेवलपिंग है, ये स्लोली धीरे धीरे चल रहा है, लॉस ऑफ वेट सब चल रहा है, सब चल रहा है. ओके, पेशेंट इज लेस प्रॉब्लमेटिक बट एक्चुअली इज मोर अफेक्टेड. सो दिस इज व्हाट यू हैव गॉट. नाउ यस, you go to one more case now.